What is the recovery time like for hemorrhoid surgery as opposed to like an embolization procedure? If you were to have surgery, what's the recovery time? It kind of depends really on the type of surgery. The three main types of surgeries that you are probably going to get offered if you're looking for surgical treatment option is going to be a hemorrhoidectomy. That's where you surgically go into the operating room, the surgeon goes in and actually removes all of the hemorrhoids. The recovery could be several months. It can be quite painful for at least 2 or 3 weeks, and you gradually can get better from there. Then there's surgical ligation, where the surgeon doesn't really take them out, but what they do is they ligate, meaning that they use little strings to kind of cut off the blood supply with some sutures, and they ligate it. Now that recovery is usually 2 to 3 weeks, can be painful for at least 3 or 4 days, and then gradual improvement over 3 or 4 weeks. And that's another procedure that does require a fair amount of anesthesia. Next is the stapling procedure, where the GI doctor can go in there and band the hemorrhoid with some staples. Usually the recovery period is a few days. It can be quite painful, but it is through the rectum that this procedure would have to, it's an anal type of procedure. And so the complications, are all based on the invasiveness of the type of surgery, but the recovery times definitely vary based on what you're kind of being offered. The other good news is there are less invasive treatment options that don't require an anal procedure, like the hemorrhoid artery embolization procedure. But to find out more information about any of these procedures, or if you're a candidate for other types of things, feel free to just call us or email us back on this email chain with your specific questions or a request to be seen, and we'll be happy to see you. Take care.